Thank you for joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. The briefing will begin shortly. Reporters who have questions during the briefing may submit those to the Task Force Public Information Contact, and we will attempt to address those during the briefing or as quickly as possible after it concludes. I'll now turn the briefing over to Dr. Alex Garza.
Okay, thank you and good afternoon, everybody. Thanks for joining us. I hope everybody had a good week. We'll get to our regional data in here in just a few moments, and it continues to be good news as our rolling averages continue to move in the right direction. These are all important trends and one that are leading on our continued deliberate and cautious reopening of our economy and allowing our communities to do more activities while preventing secondary waves. As we continue to reopen, though, it's really important to remember not to be complacent. And you've heard me say this over and over again, that the virus is not gone, and that we still have to be really careful and do all of those things that we've talked about before, like social distancing, wearing masks, and washing our hands. But with that, let me share our current updates, and we'll be happy to take some questions from the media. So here's the chart showing our hospital admissions data, and it continues to show nice progress. Again, it shows the trend in our daily new hospital admissions since early April. And since we last spoke about 10 days ago, our daily data has been fluctuating, as we said it would, but it's important to pay attention to the blue line, which is the 7-day rolling average, and not really to those day-to-day differences. Remember, the data is delayed by 2 days, and so the latest data that we have is from Wednesday. And we had 13 admissions on Wednesday, which dropped our rolling average to 15, which is extremely promising. And that's our lowest number that we've had since we started recording data in early April. Now, we'll continue to monitor this data as we enter our next phase of reopening next week in Missouri and across the region. So moving on now to our hospitalization data. The numbers continue to show progress as well. So this is, as you know, our daily hospital census of COVID positive and suspected COVID patients. So our 7-day rolling average is represented again by the blue line. Today's rolling average is 274, and it continues to decline. And just to put that into perspective, when we did our last live briefing on June 1st, the rolling average was 363. So we've seen a significant decrease in the number in just a few weeks, which is also encouraging data. Today's overall hospital census decreased as well. So today it's at 258, which is down from 331 on June 1st. And we want to see these continued downward trends, and we want them to stay down. And it represents all of the hard work that everybody's been doing in the community. Now let me share with you some of today's numbers. And so as I've mentioned before, these are all of our COVID positive plus suspected COVID patients. We have 258 hospitalizations today. We have 57 confirmed COVID or suspected COVID patients in the intensive care unit, and we have 29 confirmed COVID or suspected COVID patients on ventilators today. Now moving on to our good news slide, we've had 17 people, COVID patients, discharged from our hospitals today, which brings our cumulative total to 2,530 since our first confirmed COVID patient in the region. In a week since we've last held our briefings, that's 243 patients that have been discharged. And again, that is a compliment to all of our healthcare workers who have worked really hard to get these patients better and to go home. So thank you again to all of our healthcare workers. So let me conclude by saying that the progress in this region has been just really incredible. And it's still extremely important, though, to remember that the virus has not gone away. If we want to continue to enjoy the relaxing of the measures that were put in place just a few short months ago, we still have to remain vigilant. Wearing masks while out in public, practicing social distancing, washing hands frequently, staying at home and getting tested if you're sick, these are all keys to allowing us to continue to reopen our communities and prevent any second waves from occurring. Now we'll keep a close eye on this data and we'll make some decisions as we make decisions going into the next phase. And so with that, be happy to address any questions from the media.
We've not received any questions from the media today, so that will conclude our our press briefing for this afternoon. If anybody in the media has any questions, feel free to reach out to our press contacts, and thank you for tuning in.